So last week I started a PRN position here in a great plain state of Illinois. I haven't done any kind of staff positions since I want to say 2019, 2020, because I've been travel nursing for the last 3 years for the most part. So I've just basically been doing contracts, then maybe taking like a break in between contracts and just moving around a lot. But this time around, I decided to stay a little bit local, spend some time with the family. I, of course, haven't been here for longer than I want to say a week for the holidays, so I wanted to take this opportunity to just kind of lay low, stay here, kind of stay where I grew up, and just be with family for a little bit. But I also wanted to make some money. So I'm 29 years old. I looked into some local contracts, but I was like, I don't really want to do nursing full time yet. I wanted to take a little bit of a breather in a sense. So I also looked at doing part time and also just doing staff full time. But staff full time, I was a little bit less interested in that than travel nursing, because traveling full time offers you a little bit more money versus the staff full time position. So I came up on part time, and that was twice a week. But the places that I looked at, they offer more money for registry positions versus part time positions. So I'm like, I could do part time. I can give him my 2 days a week or 2 nights a week, and I'll be okay with that. Or I could do the registry and get paid a little bit more, have more say on my schedule, and kind of just fill in wherever I feel like, in a sense. So I thought that would be probably my best choice. I think that would be the best idea. But the thing is, with registry versus part-time or full-time, is you, of course, don't have the benefits. So there's no 401k attributed to it. There's no insurance attributed to it. So I have to basically figure that side of things on my own. But with travel nursing, I kind of had that figured out for the most part. So I haven't had any issue with that, because I don't mind working more than once a week. But like I said, I wanted to maybe just still have a little bit of a break from bedside, with the goal of probably doing a local contract sometime in the upcoming month, sometime in the fall, when rates go up a little higher. I was thinking about doing the travel contract full time and then just doing the registry position 3 times a week at the hospital. So I'm gonna to maybe try and juggle both at the same time. Is it doable? I'm not sure. It's only 3 months. I haven't really had a part in my life where I worked 4 days a week, in a sense, because if I do the contract and then I also do the registry position, then I'm going to either have to do like 6 shifts in a row, or I'm going to have to do 4 shifts a week for 3 weeks out of that month, because the registry position, I'm required to do 3 shifts a month, one of those being weekends. They're really lenient on the weekend shift. They just want me to basically do just those 3 shifts. So if I do those 3 shifts, there's 4 weeks in a month. So if I do decide to do a contract, then I'm going to have to work either, like I said, 6 shifts in a row, or just do 3 weeks of 4 shifts. So that, looking at right now, that a little disheartening. Is that something that I'm looking forward to doing? But I want to just make some good money, and I also want to go to school. So this is the position where I'm at right now, is working more hours or going back to school in a sense. I do enjoy bedside, so that's the little bit of the situation. Is I like where I'm working. I like where I'm at, but it's like, is this something I'm going to want to do in 10 years, in 5 years? I really enjoy the stuff that I do. I really like everything that nursing comes with: the family, the patients, the coworkers, the managers, the doctors, everything that goes into it. I really, really enjoy. So it's kind of like a hard step, but it's a step that I have to take. I have to figure out what I want to do with nursing. That's why I did an episode a couple weeks back about become a nurse practitioner, because one of the reasons why I decided to do registry position and PRN is because I really want to figure out school. And you guys know that if you work full-time in nursing, you don't really have a lot of time to do other stuff. So I still like working out. I still enjoy doing a podcast. I enjoy nursing. And now I want to look for school. So I have to sacrifice something to get that time to look at schools, because you got to make phone calls. You got to do a handful of stuff. So I figured, my financial situation isn't bad. I'm more fortunate than a lot of people. I travel nurse for quite a bit of time, so I have a nice nest egg, you could say, for me to just kind of chill for a little bit until I figure stuff out. I mean, of course, I'd like to have more money, but money isn't everything. Sometimes you gotta take the pause on the money and figure things out for you to make more money, So I'm doing registry for now. I'm just doing once a week. Maybe I'll do twice a week, maybe 3 times a week, depending on how my weeks go, you could say. But while I'm trying to figure out school, because my plan is to go to school in the, I believe I was looking at the spring semesters are the ones that are coming up. I kind of missed the fall ones. In a sense, I could still apply for the fall ones, but a lot of schools are already booked up, and I don't want to have to go overstate. I'm probably going to look at schools that are more in this area. So my next option would be to do the spring semester, which I'm totally down with. I can make some money before I go to school, and when school happens, I could go back down to registry, or I could just not do any more contracts and focus on school, the podcast, and just work and just my life in that sense. So registry, of course, the best option. And what's also nice about registry is they used to offer extra pay if you picked up more shifts than you are required to at registry. So they would offer, depending on how much you pick up, it was like $300 or $350 or $400 report pay, it was called. They don't offer that anymore, unfortunately. But what's nice is that the hospital that I work at, they have something called like emergency pay or crucial pay, and there's like 3 levels. So I'll be honest with you guys. So the job that I took pays a little bit over $45 an hour. For simple math, we'll keep it at 45. Lower than I'm used to, you know what I'm saying? Definitely lower than the hourly pay that the travel nursing provides, but this hospital is really close. It's like 15 minutes away from where I live right now. It's a hospital I used to work at. I know a handful of people. I know the manager there. I had a good experience there. I really enjoyed it a lot, and it's the cardiac ICU. So registry would just say, no, we'll even do some simple math. We'll just do 50 an hour, just so I could give you guys an idea of how much you could potentially make as a registry nurse in the hospital. So simple math, we'll do $50 an hour. You know what? JK, I'm gonna use that $45. I'm gonna go 45. So my pay is a little bit over $45, but I know simple math is gonna be 50. Let me do the 45 that way. It's always good to underestimate numbers, because you got taxes, all that kind of stuff. So, and you're budgeting, you're better off underestimating your income and overestimating your spending, just so you have a little bit of that leeway, a little bit more room to work with. So just say $45 an hour, and they have these 3 levels. There's 4 levels of this crucial system. So the first level offers you $10 more an hour. Second level offers $20 more an hour, and the third level offers $30 more an hour. And then they have this 4th thing where it's not a crucial level. It's just like a little bit of an add-on of $10. So technically, what I could do is I could, in a sense, make anywhere from $10 to $40 more dollars an hour. Technically, maybe even $20 to $40 more dollars an hour. So that jumps the pay up from $45 to $65 and even $85, which is a really, really good amount for registry position, registry job. So they don't offer this every single day. I've only been there a week. I've talked to a handful of people, and they said they don't really pick up so often, so they haven't taken advantage of the crucial pay. So there's something new that they implemented. I think it's maybe like a month and a half into it being rolled out. So I didn't really get a good idea of how much shifts you could pick up under that crucial pay. But my manager said that it's fairly often that I should be able to get it once every so often and to capitalize on it if I have the opportunity to. So that's an interesting position, because that would be really clutch if I could get that crucial pay of $40 more an hour. That will put me into $85 an hour, which is basically almost twice as much as my hourly rate. But I'm really curious on how that works. They said that I could either get it added on at the end of the pay period. They also said that I could get it added on at the end of the month. So there's different ways of you getting paid out that $20, $30, $40 extra. But I'll tell you guys more about that once that comes into play. But nobody really gave me an honest idea of how often they do this crucial pay, because if it's like a once in a month kind of thing, that kind of sucks. But if it's more of like a weekly thing, bi-weekly thing, I'd be more willing to pick up, because being registry, I'm in it for the money. I do enjoy nursing, but I want to make some money, especially if I do decide to go to school. Registry is the way to go. So with the registry position, just as a refresher, I'm only required to work 3 shifts a month, one of those being a weekend. But of course, they are lenient on the weekend. So as long as I just do 3 shifts a month, they're completely fine with that. And on top of that, if I pick up more than the required 3, I can get something called crucial pay, which can give me anywhere from $10 to $40 more an hour.